Welcome to Power Up Recovery with Nutrition. It is time to make nutrition part of the conversation. I'm your host, Christina Veselak, and I'm so glad you're here. Did you know that it's our brain's job to allow us to cope with stress gracefully? But to do that, it needs to be fed optimally. Have you ever wondered why so many committed people relapse or maybe even die? Why so many people on psychotropic medication still feel lousy and still have cravings? What if the missing piece is food, the right food? What if the right nutrients like amino acids or even eating protein every 4 hours could actually balance your brain chemistry and your mood without medication and support lasting recovery? In this podcast, we explore the powerful connection between feeding your brain well, mental health, relapse, and recovery from addiction. We will share insights from experts, inspiring recovery stories, and practical strategies you can use today. Whether you're in recovery, a healthcare professional, or someone passionate about emotional well being, this show is for you. Let's dive in and discover how fueling your body and brain with the right food, the right amino acids, and other key nutrients can fuel your transformation today. Welcome. Hi, everyone. Welcome to the next episode of Power Up Recovery with Nutrition, where you get to hear wonderful stories about how food and purified food in the form of supplements has transformed people's lives, their mental health, and their recovery journeys, some top level science, and how clinicians are taking this wonderful top level science and using it to help the ordinary person. Glad you're here with us. And today I would like to introduce a wonderful colleague of mine, Dr. David Wiss, who has been at the intersection of eating disorders and food addiction for a long time, has done some very groundbreaking research, as well as being a father and a clinician.
Thank you
So
so much.
welcome.
Yeah, I'm so thrilled to be here. I love chatting with you and excited to build some energy today.
Looking forward to it. So why don't you start by just sharing a little bit about who you are, what you do, how you got here, and then we'll jump into some juiciness.
Yes. So I'm from Los Angeles and uh, grew up in the public school system, and I went to USC, which is in the downtown Los Angeles area. Had no idea what I wanted to study. I once took a nutrition class as an undergrad and I dropped out, just to give you a sense of the different directions my life has gone. I couldn't handle it. And when I circled back to health for my own personal wellness journey, I found nutrition and exercise to be transformative, specifically for my anxiety. Um, and I knew that I wanted to be helpful in the space. People were asking me for help. So I switched paths when I was 24, 25, and I went back to a community college, started studying the biochemistry prerequisites to become a nutritionist. I found the registered dietitian nutritionist path, went to Cal State Northridge to get my master's degree, and I did a master's thesis on nutrition and substance abuse, which is what we called it at the time. So I had my first data collection experience in the VA, and it was just a survey study, but we were able to find that people with a history of substance use disorder were more likely to overeat when they were depressed. And I started connecting some dots. This was 2012, right when the food addiction research was really starting to emerge. And I became interested in addictive eating and disordered eating. And I noticed very quickly that there were divergent views. There were people that were saying, don't worry about the food, a calorie is a calorie. And there was research that was saying, no, food is profound signaling information to the brain. and
Yes.
we need to think about this as well. So I launched a company called Nutrition and Recovery, which brought nutrition education to treatment centers.
Mhm.
I was very comfortable in that environment. And a lot of my buddies were launching rehabs, and it was right at the time when the DSM-5 came out and substance use disorder was recognized, and there were no nutritionists in rehab. So I built a company that brought our services on site. So we do groups and one-on-one, mostly for people that have medical issues and a lot of disordered eating. So I became a expert in eating disorders pretty quickly because that's where the referrals were coming from.
Mhm.
Unfortunately, most places still don't recognize anxiety, depression, trauma, and substance use disorders as needing nutrition intervention and care. And mostly when people have restriction and binge eating or purging behaviors is when they say you need a nutritionist. So I
Mhm.
started screaming from the rooftop, nutrition is important for people with mental health challenges, regardless of whether or not they have an eating disorder. And so I found a really powerful niche at the intersection of them all, and have been in private practice for 13 plus years, working one-on-one with people all over the world. Eventually, I knew that a master's level wasn't going to satisfy me, and I wanted to do more research. So I went back to school to get a doctorate at UCLA in the School of Public Health. I wanted to do some pretty creative research on nutrition, lifestyle interventions in treatment, neuroimaging outcomes, but I
Mhm.
wasn't able to get it approved because it just wasn't established enough. And I
Right.
remember really having some difficulties in my PhD program, wanting to do more cutting edge research.
Sure.
But I ended up doing my dissertation on adverse childhood experiences and mental health. So I became very interested in trauma and how that plays out over the lifespan, biologically, psychologically, and socially.
Mhm.
And that sort of led me to broadening my scope just from really a narrow focus on nutrition for addiction and really thinking about nutrition for trauma, depression, anxiety, and of course, the emerging field of nutritional psychiatry, thinking about ADHD and OCD. And there's a lot of biology involved in these mental health presentations. But there's also a lot of cognitive factors and psychological factors. And so I've been positioned to do counseling for people that are on a recovery journey and to bring
Mhm.
in psychological insight and combine it with biological insight in the fields of functional medicine. I launched the Wise Mind Nutrition app a few years ago, which supports mental health using nutrition. That's been a long journey and a ever evolving process. It's been really fun for me to learn tech at a
Mhm.
high level and to think about ways to leverage mobile apps to help people. I'm still wanting to do research using my app, but haven't got there yet. But it's really exciting. And then pivoted to functional medicine as a way of expanding beyond the narrow nutrition scope.
That's right.
So yeah,
Of a registered dietitian. Yeah.
yeah. And so my identity as a dietitian in addiction treatment has slowly evolved over the last few years to doing functional medicine for mental health.
Well, congratulations. I mean, it's been quite a journey, and it kind of parallels mine in
Yes.
some way as well. I started out as a psychotherapist and addiction counselor,
Mhm.
and then discovered amino acids and nutrition and functional nutrition, and then discovered trauma
That's right.
because, of course, trauma wasn't even in the DSM when I originally went through school. PTSD was not understood to be a thing yet. And so, the last 25 years, I also have sort of been integrating, weaving together all of those strands, addiction and trauma and the brain and nutrition.
You've been screaming it from the rooftop, and I'm so proud of you.
Thank you. Well, I've been trying, but I also have bumped up against many of the same things you have, especially when I talk about, nutrition and substance use disorder. People immediately assume that I'm talking about eating disorders.
Mm-hmm.
It's directly where the brain goes. And they say, well, eating disorders are important, but I'm actually talking about the value of nutrition for all the other addictions as well.
That's right.
And people look at me blankly.
And I have also experienced those blank looks, and I've come to understand that we do need to follow the data, and that I was really screaming nutrition for addiction from the rooftop for 10 years. And I saw that there was more evidence to support nutrition for depression and emerging evidence about nutrition for anxiety and nervous system support with trauma. And so it is probably safe to say that I've pivoted a little from just saying nutrition to support addiction and saying nutrition to support some of the underlying conditions.
All of it, because of course,
That's right.
addiction is a response to discomfort. It's a response to disordered brain chemistry and depleted neurotransmitters, which, of course, we say comorbid, but they are inextricably entwined, whether it be depression and anxiety or insomnia, and seeking relief by using substances or behaviors that temporarily fire those neurotransmitters.
That's right.
So it's all the same game, no matter which angle you come at it.
The big question will be, where will there be enough evidence to eventually get it supported by the healthcare system, right?
Well, where I'm beginning to head, and I would be interested in your take on this, I'm actually putting together a um, mini certification program for continuing education for the American Psychological Association on nutrition and mental health. And where I'm starting is by looking at reminding people that the brain is actually a physical organ.
Mm-hmm.
So my language has changed over the decades that I've been talking about this. And what I'm saying now is more along the lines of our brain actually requires specific nutrients to function.
Mm-hmm.
We need to be getting these nutrients in on a regular basis. If we get all of them optimally, our brain functions optimally, and therefore we are much more able to gracefully deal with the stress in our lives. But if the brain does not get these fundamental, crucial nutrients, nobody does very well.
And I agree with that. And one thing I bumped into in my doctoral training was a split between biological scientists and social scientists. And
Right.
so I've definitely encountered the thought that, overemphasis on biology can miss the psychosocial contributions, right? A lot of people tend to look at mental health as being socially constructed through lived experience, and a lot more of the psychosocial view. And yeah, they don't love the overemphasis on biology because they weren't trained in biology, right? And so the real gift, in my opinion, is being able to integrate all three philosophies.
It is to be able to integrate all three philosophies. Exactly. This is why I have my three-legged stool model, biochemical or bionutritional, psychosocial, and spiritual. And
Mm-hmm.
we need to be addressing usually all three at more or less the same time. But the fact is that our behavior and mood is actually really truly driven by the brain. You know, I am not a reductionist, but I am a reductionist in that one area, that stress, environmental influence, all of that still both impacts brain function and is interpreted and mediated through the ability of the brain to step up and allow us to respond either effectively or non-effectively or semi-effectively. And that therefore giving the brain the food it requires to function allows us to gracefully cope with whatever stress life is going to put in our way.
That's right. And all of it's mediated by the gut, right? That important midpoint that we have to always factor into our models.
And then it's all mediated through it all interacts with. It's this wonderful interactive, I don't want to use the word machine, wonderfully interactive, interresponsive organism.
System.
I was originally trained as a marriage and family therapist in systems theory,
Right.
right? And if you tweak something here, it's going to impact something there.
That's right.
Bidirectionally.
That's right. And one of the things that I think is often ignored or overlooked is that in the context of substance use disorders and addiction, we generally assume that the trauma, the depression, and the anxiety is the underlying driver. But we also know that people that are susceptible to addictions, that engage in addictive eating and early substance misuse, it also can cause more trauma, anxiety, and depression. So thinking about these things multi-directionally is critical.
Well, and because substance use impacts our brain, it depletes our neurotransmitters, right? So we're more liable to have tolerance and cravings and increased depression, anxiety, and insomnia. But it also disorders our spiritual life.
That's right.
It disorders our relationships. It disorders our work life. It disorders, right?
That's right.
On and on and on and on. And so we have this downward spiral. And so where do we intervene in this downward spiral, right?
That's right. And I think the big question is, do we know enough about diagnoses to develop interventions based on a diagnosis, or do we need to look at the person, not just the diagnoses, right? Because I think a lot of people will argue that even addiction, substance use disorder is heterogeneous, that like not all the brain chemistry is identical. Some people have dopamine receptor dysfunction. Some people just have the relic of a traumatized brain. And the same could be true for ADHD presentations. And so I think we're at a time where we need to do a lot of testing to figure out what people really need. And I think that's the future, where we can do a little bit more blood, urine, stool, saliva testing. And I think that will really help connect dots for people.
Where do you like to start in terms of testing? I mean, there's so many things about what you just said that I would love to jump on and run with, but I'm going to run with that one.
Yeah, in a perfect world, we would do multiple tests and be able to analyze the results simultaneously. The problem is that insurance doesn't cover a lot of the specialty lab tests that we do in functional medicine. So a lot of folks aren't able to afford several tests. But I'm a big fan of stool testing. I like Genova GI effects. I find that to be super helpful. I do like organic acid testing, which comes from the urine. There are specialty lab tests that combine urine and blood to see what are some functional needs of the body in terms of vitamins, minerals, fatty acids, amino acids, and antioxidant support. I also started doing more hormone testing recently.
Yes, you have to.
Yeah, you have to. And so if you bring in like the standard lab tests for nutrition and metabolic function, and you do, I do the NutriVal frequently, which is
Mhm.
another Genova lab. And then
Yeah.
we do a stool test and a hormone test, some of which combine urine, blood, and
You kind of
saliva.
covered all your bases.
Cover all the bases, and with a saliva test, you can get some genetic vulnerabilities, which can match some of the findings in some of the tests. And then, I've also recently been doing some toxin testing, looking at, you know, bisphenol A, forever chemicals, to be able to see the body's need for elimination support and biotransformation. And so, yeah, it's pretty exciting to be able to do a battery of functional lab tests and to see where the data converges and to get a really good story about neurotransmitter function and, gut health, et cetera.
Well, it really is. And a lot of clinicians and patients can wonder where to start because it can seem so overwhelming. And this is why I actually created my flow chart approach to all of this. And that was my presentation at IMMH this year,
Nice.
right? Is where do you even start?
Right.
And so, what I teach my students and what I presented is I think you start with food. You start with ingestion.
Mm-hmm.
Are you actually eating and taking in the nutrients that you need for your body and your genetic and ethnic background?
Mm-hmm.
Secondly, are you digesting it? Are you producing enough, digestive enzymes to break it down into its component nutrients?
Mm-hmm.
Third, therefore, are you absorbing adequately what you are? Because here we bring in the gut, right? Are you absorbing the key nutrients that the brain needs to function? Or is it getting a little messy and you're not absorbing the right things and the wrong things are getting into your blood and therefore your brain? And how is your elimination? Are you actually getting the toxins out of your body, or are
Okay.
they just recirculating and having a heyday while we feel more and more miserable?
I've been a food first practitioner for most of my career, and I share the same philosophy. And one of the things that and I'm sure you've noticed, is that when you factor in life stressors, addiction like eating, convenience eating, accessibility, like making some of the dietary changes is very difficult for people. And that's why ongoing counseling and support, or using an app like Wise Mind Nutrition, can be very helpful. So you can really take a look at, the colors in your food, the food groups that you're eating, and that sort of thing. Because if it were just as simple as, here's an anti-inflammatory eating plan, Mediterranean style, low in carb, here's the thing, like, let me know how it works, people would be doing that pretty easily, right?
People, people would be,
Yeah.
people would be.
Behavior change is hard.
Well, behavior change is hard. And this, I think, is where supplements come in
Agreed.
because I like to begin with food and end with food. And in the middle, let's use some purified food.
Yep.
And sometimes people need, Julia Ross is really big on this one, that sometimes you actually have to give people the targeted amino acids to raise their neurotransmitters sufficiently that they are capable of
Hmm.
feeding themselves and making the dietary changes they need to make. Right? So, chicken or egg, where do you actually start? Well, we start with food when we can, and sometimes we can't. And then you bring in, I mean, I've got a client right now who is having, she doesn't have an eating disorder per se, but she has absolutely no appetite.
Mm,
And so she has very disordered eating.
sure.
And so can we just bring in a few supplements to just get this upward spiral going? Get your brain fed enough that
Yes.
maybe your appetite comes back.
Some zinc, some omega-3. Yep. some support
Yep, maybe
there.
some tyrosine, to get some motivation going.
Yes. Have you found that some people are lacking in single amino acids because their body's not breaking down the whole protein? They don't have a lot of digestive enzymes that break down protein, because that is one of the findings that does seem to emerge from testing, is that they're taking in adequate grams of protein, but their body's not breaking it down properly into the single amino acids. And so sometimes doing, some different protease, protein related enzymes can be supportive for that goal as well. Or hydrochloric acid.
Or hydrochloric acid. I think there's a couple of things involved there. One is genetics, and then the other is actual digestion.
Yep.
So, yes, we need to be chewing enough to be getting your hydrochloric acid released enough to start breaking down your proteins into your peptide chains, where they can be then broken down into the individual aminos by the proteases down the road. But we need sufficient hydrochloric acid for the pancreas in the small intestine to release your proteases and your lipases and etc. to finish breaking them down. We need enough hydrochloric acid to get bile produced to start breaking down your fats.
Mm-hmm.
So it kind of starts in the mouth, but there's so much action that happens in the stomach. And then if something's gone wrong in the stomach and they've been on a proton pump inhibitor, PPI, forever and a year, nothing's getting broken down. Very little's getting absorbed. There's this downward spiral that's just happening slowly and insidiously that nobody's noticing. And you finally track it back to you have not been absorbing your nutrients for decades because you're afraid of heartburn. It's actually due to not enough stomach acid in the first place.
Agreed. It's a
This is
huge.
why I like starting with looking at the stomach.
That's right. We're on the same page there. We always say start with the gut.
Well, start with what you put in your mouth, and then you look at your gut, right? Because you
Of
do have
course.
to put it in your mouth first.
I love what
Either
you
what
said
you
about
put in
chewing a
and what
lot
you
more. It's
don't put
important.
in. We got to chew a lot more. But what I meant by genetics is, and the reason why I think individual amino acids are absolutely necessary at times, not just, a full spectrum something
Hmm.
or getting enough protein in your diet, is because of genetic polymorphisms
Yes.
and blockages in your various neurotransmitter pathways. You see, not just dopamine. Everybody, thinks addiction and it's all about dopamine.
Right.
Well, a lot of it is about dopamine, but the fact is that all these other neurotransmitters, GABA, serotonin, the endorphins, impact firing of dopamine in the nucleus accumbens, number one. And number two, it ain't all about dopamine,
That's right.
right? Because many of these substances fire your other neurotransmitters too. We don't just want the dopamine effect. We want the serotonin effect. We want the GABA effect. We want the endorphin effect. Ooh,
Mhm.
warm fuzzies here.
I've become
And
interested in the glutamate GABA ratio.
yeah,
Glutamate being excitatory and GABA being relaxing. And I think it's probably safe to say that if there is too much glutamate and not enough GABA, anxiety can present.
tremendously,
Yeah.
tremendously. And what creates too much glutamate and not enough GABA? Well, among other things, including some genetic SNPs, we have deficiency, frank deficiency in zinc and B6. If we are not getting enough zinc and B6 in our diet or absorbing it, which requires hydrochloric acid, we will not be converting glutamate to GABA, and we will not be converting 5-HTP to serotonin for that matter. So now you have a double anxiety whammy.
Too much carbohydrates as well. And I think one of the reasons why people feel better on lower carb or ketogenic approaches is because of the glutamate GABA piece. And I'm actively trying to learn more about that to really understand the mechanisms.
Can you talk about that a little bit, even just what you do understand so far?
Yeah, I have, been following ketogenic approaches for many years, and because of my background in eating disorder treatment and care, I've always had a little bit of a bias against it because I've
Mm,
seen a lot of people attempt those approaches and end up with rebound binging, or they have
yeah,
weight loss that's very reinforcing and then end up gaining it back plus some, and then have, some more reward
right.
sensitivity to foods that they've been avoiding. So I've always sort of looked at ketogenic diets as, a lever that people pull for weight loss. But in the last few years, it's become very obvious that a lot of people are reporting tremendous mental health benefits from ketogenic approaches. Obviously, the research has been in, more severe mental illness, right? The metabolic psychiatry work from Chris
Right.
Palmer and Dr. Georgia Eady and others.
Mm.
And yeah, I've been open-minded in the last year or two about ketogenic for mental health. Um, and I do think that one of the mechanisms is more GABA, less glutamate, less anxiety, could be in the context of body noise, food noise, etc. And I do think that there's promise there. However, it's like we said earlier, a lot of people do have challenges with adherence. And I think if people like cycle off and have guilt and shame and try to get back on, they're checking their urine, it can be disruptive to someone's life.
It can become obsessive, it can become disruptive, and not everybody needs it.
Agreed.
And even Dr. Palmer in his book Brain Energy, most of the case studies in there were not people going hardcore keto. They were people eating real food
That's right.
in a balanced manner.
That's right.
We have our 5-star pro recovery diet. That's where I don't think you need to pull somebody from a diet of ultra processed crap food to all the way to keto.
Agreed.
I think you need to get people eating real food. And the more they eat real food and you're supporting digestion, the less people are going to want to eat crap food. It's
Hmm.
not the only mechanism behind, addictive eating, but it is one of them, right? Once you get the brain well fed with real food, these food addictive urges do actually automatically start decreasing. So that's the first step. And by doing that, you're giving the brain the fuel it needs for the mitochondria to start working. You're balancing blood sugar to start offsetting metabolic issues.
Hmm.
And so a lot of the arguments for the ketogenic diet are offset just by what happens when people eat real food over a period of time. Now, not everybody. For some people, and here you have the more extreme. See, I still see the keto diet as a medical diet for people for whom ordinary food, for whatever reason, ordinary real food isn't sufficient,
That's right.
where there really are such metabolic imbalances and such mitochondrial insufficiency that you really do need to start from square one.
Pull a stronger lever per se, but I think I share the same philosophy with you. And a lot of my research on ultra processed food addiction, or what some of us are now calling ultra processed food use disorder, has concluded that, yeah, if it's true that it's mostly ultra processed foods that are problematic, highly rewarding, dopaminergic, etc., then the solution is to just quote unquote eat real food. But then we do have some food addiction camps that say that's not enough. It needs to be weighed and measured because I have compulsive overeating regardless of the food. There's some people that say it needs to be super low carb. There's some people that say it needs to be keto, and there's some people that are full-blown carnivore, right? And so part of what I've done as a scientist and a clinician is observe the different approaches that people favor based on their own
They,
personal experience and just try to describe it. and then offer people solutions that aren't biased by my own personal experience, but are open to a lot of different paths.
Well, here's the issue, I think, and that is the scientific method really is in favor of one size fits all. We want a solution, a nice, elegant, simple solution that works in 100% of the cases. Isn't that lovely?
I'm always interested in the outliers. And I found that if you want to sell a book or go viral on social media, you got to take like a strong stance on something. And as a scientist, I just haven't been able to commit to one approach. And sometimes I
But
think,
here's the issue. We're genetically diverse. We're ethnically diverse. We're culturally diverse. One size does not fit all. Okay, not all people are going to do well in a carnivore diet. Not all people are going to do well in a vegetarian diet. Some people thrive vegetarian or vegan. Other people thrive carnivore.
yeah, I've observed that a lot of people are attracted to different approaches, not based on, biochemical individuality, but also the social identity. Some people connect with plant-based eating or are into, carnivore or paleo approaches from gym culture. There's a lot of different reasons why people are drawn to certain approaches.
But
And
it's not necessarily good for their bodies or
that's right.
brains.
That's right.
Yeah,
And I've always had to explain that to people. I don't pretend to know what the best approach is for someone. I just ask good
that's right.
questions and I say we can do some testing and see what
Yeah.
emerges.
We can do some testing and see what emerges. Exactly. But the other thing is, tendency towards obsessively eating high sugar, high carbohydrate foods. This is not just about dopamine. This is also about low serotonin.
Right.
Because when serotonin is low, it's been shown that we crave sugar to drive tryptophan across the blood-brain barrier to raise serotonin levels. When serotonin is low, we tend to be more obsessive and more compulsive. So now we're obsessively and compulsively eating sugar to raise serotonin levels, right?
I saw a really interesting study a few years ago on individuals with anorexia nervosa, restrictive
Mm-hmm.
type. And I think the investigators concluded that in this specific presentation, many of them had too high of serotonin. And that's why I'm extrapolating their findings. I think it's maybe safe to assume that that's why many people with anorexia nervosa are fearful of carbohydrates, because if they get carbohydrates and get more serotonin, it can induce anxiety. So too high of serotonin can also be a problem. So this is a perfect example of biological underpinnings in eating
Mm-hmm.
disorders that are often ignored. You'll have, therapists and other clinicians say, these are irrational fears based on body image, but it actually might be their own distinct neurochemistry that's clustering with OCD symptoms and their malnourished brain.
Well, it really could be. Or gluten intolerance. Celiac disease really is a thing.
Yes,
I have it.
got it.
Now, some people may not be as gluten sensitive as they think they are, but other people really clearly are. Or you've got some people who are sensitive to the glyphosate coated, genetically modified, over glutenized grains that we eat here, and they have real symptoms, and they go to Europe where the wheat is very different than the wheat is here, and they have no problem. They come back here, and all their GI problems come back.
Yeah.
Okay, this is not made up in your head. It may impact your head, but this is actually physiological and can be tested for. So if somebody is actually gluten sensitive and they find that they feel better off gluten, and then maybe they feel better off dairy, and then, oh my God, this is so hard. So let me just, restrict, restrict, restrict. we go through orthorexia and then people end up just in full blown anorexia at the end of the process. They go into eating disorder treatment, and the therapist says, see this lovely cake? It's
Right.
not going to hurt you.
Yeah.
And it actually does.
Because they're not incorporating the biology into their clinical picture, which is what I think you and me are both saying. Don't ignore the biology. Let's bring it in, right?
Let's bring it in. And at the same time, people do have maladaptive beliefs.
That's what I
People
deal with a lot.
are obsessive. People are frightened. People do dot, 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 right? We are human beings. And so we go back to one size does not fit all. It's the three-legged stool. And let's be person oriented rather than ideological.
There's also situations where maladaptive beliefs affect biology in a profound way. There are circumstances where restrictive eaters might have really pronounced fear of pizza, for example. And there are cases where the guilt, shame, and remorse and the conflict around the pizza could be more harmful to someone's health than the actual pizza. And this is what characterizes more classic presentations of eating disorders. And so I
Yeah.
do incorporate a lot of that wisdom as well.
A colleague of mine once talked about genetic interpretation as a 3D chess game played upside down underwater. And I think that's a wonderful description for some of what we're talking about.
I like that a lot.
But I think we have to begin with the person, end with the person, begin with food, end with food. And in the middle, we get to do all sorts of fun things.
Bring in joy and celebratory energy. Get someone to be excited about going to the grocery store and cooking and connecting the
And
food.
tasting, and
Spiritual
tasting,
context. Yeah.
right?
Yeah.
We get to learn how to enjoy, because once we learn how to enjoy and savor tastes, savor textures, now we're actually healthily firing dopamine and the endorphins, right? We get to make our own, but we have to learn how to slow down and enjoy. We have to give space. Now, can we help that with some dephenylalanine? Sure, we can. On the other hand, we have to stop long enough to allow the DPA to allow us to enjoy.
Mm.
Both are true at the same time.
That's been my primary message, holding the dialectics in dietetics, looking at the both and rather than the either or, and ending the culture wars in the nutrition space.
Well, and that's why I love conversations with you, because, well, we get to be lively.
And it's important that we do all recognize that we have our own biases based on what has worked well for us and what we've seen in our clinical practices. And one of my major goals is to just really keep the open mind and the open heart and listen and be curious and continue to explore with people rather than try to be the ultimate authority.
See, I really love that one word you used. I love the word curious. To be curious. We get to be curious for our clients and with our clients. We get to teach them to be curious about what's going on and new opportunities in place of guilt and shame.
Mm-hmm.
And this curiosity can open up very wide, wonderful worlds to us.
And it could change over time. I tell people that a lot. Whatever you find as a well-lit path today is going to likely evolve in the future. For some people, nutrition and lifestyle interventions are rapidly impacting their quality of life. And for other people, it's much slower, sometimes so
Mhm.
slow that people don't notice it, right, immediately. And so I always invite people to think about nutrition as a life course intervention, something that affects us over our entire lifespan. And that when we think about it that way, it's a great way to zoom out rather than just look at 24-hour-a-day nutrition.
So I've got a final question for you before we stop. You're a dad.
Mm.
You have young children.
Yes.
How do you see everything you know and everything you've experienced around food and addiction and trauma, etc.? How is that going to impact your attempt to instill resiliency in your children
Yeah.
against mental health and addictive disorders?
I think it is an ongoing challenge to think about not just, what food to serve, but what the messaging is connected to it,
Mhm.
because some
Right.
of that emotional energy can be very sticky over the lifespan for some folks. And so, yes, I have a 3-year-old who is very attuned to sweetness. It's inevitable, right? At some point, the brain
Right.
doesn't detect favorable responses from things that don't carry either some sweet or some dairy-based kind of creamy saturated fat effect. And so, yeah, I watch my 3-year-old. Sometimes she'll lick something, and I know her brain is registering, is this sweet? If yes, proceed. If not, don't, right? And it's a very cute thing to watch. So obviously in my household, we do serve whole foods and have a very food positive environment. But yeah, she's been exposed to enough sweets and treats in birthday parties and in school to where she's able to recognize patterns. She could see like the package of something and already know that
Mhm.
it's, something that'll
Right.
be rewarding. And so, yeah, the ongoing battle of creating a supportive food environment, but also not using food as reward or punishment, and also just being super supportive. And one of our favorite sayings in my household is after dinner, right? She wants something, and they say the answer is yes, you can have it, but we're going to have dinner first. And she understands that.
That's a good thing to understand.
Mm.
The other thing I think is crucial for parents to start teaching their children at that age is the difference between tummy hunger and brain hunger. To notice when blood sugar has dropped,
Mm,
the irritability, the spaciness, the reactivity, the whatever, right? And that doesn't mean you automatically reach for a cookie. You reach for the protein
mm.
to feed the brain. And then you can have the yummy, right? But that these symptoms mean that your brain is hungry.
That's
And
right.
what can we do at the age of 3, 4, 5 to feed our brains?
When my daughter is ready for a deep and profound conversation about interoceptive awareness, I will be right there.
I don't think it's that hard, David, actually, because your 3-year-old starts having a meltdown,
Hmm,
right? And you run through, okay, are you tired? Are you scared? Are you hungry? Are you whatever? Right? And
that's
you
right.
land on hungry. And you give your child protein food and they feel better rather than sugar food.
Hmm,
And they start connecting protein food to feeling better, to no longer wanting to throw a tantrum in the middle of the grocery store or your living room. This is learned behavior. So what are you teaching your child? They throw a tantrum and you give them a lollipop,
sure.
or they throw a tantrum and providing they can tolerate dairy, you give them mozzarella cheese stick and they're as happy as a clam. Okay, this is up to our parents and us as parents and what we are training the dots we are training our children to connect without having to be too verbal about it.
That's right. Sometimes I wonder if my daughter eats too many cheese sticks because it's definitely on the top of her list.
Well, okay,
Uh,
so you can keep an eye on that. But meanwhile, if it regulates her, it regulates her.
it's great. Yeah, we're doing a good job with parenting, and I'm very grateful for my training in addiction and eating disorders so that I feel like we're supporting her growth in that area.
Congratulations.
Thanks.
And this is actually why I wrote my book. Have you seen it yet? The book Eat?
I see it in the background. I think I got one of your newsletters.
Well, you should get the book
Okay.
and maybe review it in your newsletter because it's called Eat, a Guide to Radiant Recovery Using Food and Amino Acids to Repair the Addicted Brain and Reduce Cravings.
I love the
But
word
it's
radiant. That's fantastic choice.
right.
Yeah.
Yeah. But it's written at an eighth grade level to make it accessible to everybody, including children. I know a couple of 7-year-olds who really like the pictures in it
Hmm.
and who say, Mommy, what does this picture mean? And now you have an opening to explain what the picture means
My
to your
angle
7.
is I took my 3-year-old to the grocery store with me yesterday, and I'm trying to do that
Uh-huh.
more and more.
That's really cool.
Yeah.
Well, it's been delightful talking with you.
Likewise. Thank you for inviting me, and always happy to continue the conversation and collaborate as we move forward.
How can people reach you?
Yes, I have 3 websites. For professionals, I have drdavidwiss.com, where you can get my research and free trainings and podcasts, etc. Nutritionandrecovery.com is my group clinical practice, and wisemindnutrition.com is my mobile app. I have social media, Instagram, Dr. David Wiss, and TikTok and YouTube is Wise Mind Nutrition.
Thank you so much.
You got it.
Well, everyone, thank you so much for joining us today with Dr. Wiss's wisdom and humor and very wide experience. If you liked this episode, please push the like button and share it with your friends and colleagues and clients. And please join us next time. Thank you so much. Thank you for tuning in to Power Up Recovery with Nutrition. I'm Christina Veselak, your host, and I hope today's episode has inspired and equipped you with new insights and tools to support your recovery journey or practice. If you enjoyed this episode, please subscribe, leave a review, and share it with others who could benefit from the knowledge shared here. Stay connected with us for more episodes filled with practical advice, expert wisdom, and inspiring recovery stories. Remember, nutrition is a powerful tool in mental health and relapse prevention. Power up your recovery today. I'm Christina Veselak, and I'll see you next time.